Welcome to Sato Cario Online Nursing channel. In today's video, we are going to discuss 20 multiple choice questions of Safdarjung Hospital New Delhi Nursing Officer exams. This is a part B video which will have the continuation of part A video. Let's go for today's questions. Question number 21. The type of blood components which are used to replace erythrocytes are option A platelets, option B granulocytes, option C packed red blood cells, option D is fresh frozen plasma. The type of blood components which are used to replace erythrocytes are packed red blood cells. Question number 22. Hormone which stimulates peripheral stem cells in the bone marrow to produce red blood cells includes option A renin, B angiotensin, C erythropoietin, and D is aldosterone. Which hormone stimulates peripheral stem cells to produce red blood cells from bone marrow? The answer is erythropoietin. Question number 23. Contact precautions are initiated for a client with nosocomial infection caused by methicillin-resistant Staphylococcus aureus. The nurse prefers to provide colostomy care and should obtain which protective items to perform this procedure? Option A gloves and gowns, B gloves and goggles, C gloves, gowns and shoe protectors, option D gloves, gowns, goggles and face shield. So here the nurse is taking the protective equipments for carrying a patient who is under colostomy. So during that time, the nurse is at risk of getting the secretions or the any other excretions can be splashed over patient face and the body. So the nurse has to carry gloves, gowns, goggles, and face shield. 24. Which infection is known to occur in children in the absence of shortage of a vitamin A? Option A diphtheria, B measles, C polio, and D is rubella. The right answer is measles. In shortage or absence of vitamin A, children are prone to get measles. Question number 25. For pap smear, which is not the indication? Option A pregnancy, option B hysterectomy, option C history of intrauterine DES exposure, option D is evaluation of child's abuse or rape case. The right answer here, total hysterectomy is not indicated. Question number 26. The nurse is preparing to insert a nasogastric tube into a client. The nurse should place the client in which position for insertion? Option A right side, option B low Fowler's position, option C high Fowler's position, option D supine with the head flat. The nurse should place the client in sitting or high Fowler's position when inserting a nasogastric tube. 27. The nurse is evaluating the developmental level of a 2-year-old child. Which does the nurse expect to observe in the child? Option A uses a fork to eat. Option B uses a cup to drink. Option C pours warm milk into a cup. Option D is uses a knife for cutting food. 2-year-old child in his developmental milestone at this age, he will use his cup for drinking. Also, they will use their own spoon for eating their foods. 28. The nurse is instructing a client how to perform a testicular self-examination (TSE). The nurse should explain that which is the best time to perform this exam. Option A after a shower bath, option B while standing to void, option C after having a bowel movement, option D is while lying in bed before arising. So, in order to do testicular self-examination, the best time is after taking shower. But during the time, the patient's hands are cold, the testes are little warm. During the time, any palpation can able to identify any abnormal findings inside. 29. The nurse is instructing a client how to perform. Okay, this is the answer for that after a shower bath. Now comes to question number 29. The type of pelvis shown in this picture has the following characteristics. So see this image and identify it is which type of pelvis. There are four types of pelvis. You have gynecoid pelvis, android pelvis, anthropoid pelvis, and the fourth one is platypheloid pelvis. Okay, so this is the fourth type. So options are resembles a male pelvis. Option B making labor and birth difficult. Option C adequate outlet with a narrow pelvic arc. Option D is normal female pelvis. It is not a normal female pelvis. It does not resembles a male pelvis. And the right answer is this platypheloid pelvis will make the labor and birth difficult. Question number 30. Fetal heart rate ranges between dash during first trimester. During first trimester, what is the fetal heart rate range? Option A 160 to 170 beats per minute. Option B 110 to 160 beats per minute. Option C 90 to 110 beats per minute. Option D is 70 to 90 beats per minute. The right answer is 160 to 170 beats per minute. Question number 31. The first perception of fetal movement by the mother may occur in the option A 12th to 14th week of gestation, option B 14th to 16th week of gestation, option C 16th to 20th week of gestation, and option D is 20th to 24th week of gestation. The first perception of fetal movement by the mother is known as quickening, and this can occur during 16th to 20th week of gestation. Question number 32. The nurse is performing an assessment of a pregnant client who is at 28 weeks of gestation. The nurse measures the fundal height in centimeters and expects which finding? Option A 22 centimeter, option B is 26 centimeter, option C is 30 centimeter, and option C is 40 centimeter. So in the second trimester of pregnancy, the nurse assessing the nurse assessing the height of the fundus. So by the second and third trimester, the height of the fundus will be approximately +2 or -2 to the year gestation to the age of the fetus. Okay, so that will be 30 centimeter. The nearest answer is 30 centimeter here. Question number 33. Test used to test the presence of amniotic fluid leakage is known as option A Heeler's test, option B Hayes test, option C is Nin-Hadrin test, option D is Fern test. So the test used to assess the presence of amniotic fluid leakage is called as Fern's test. Question number 34. Which assessment finding following on amniotomy should be conducted first? Option A cervical dilation, option B bladder distension, C is fetal heart rate pattern, and D is maternal blood pressure. So followed by amniotomy, the nurse should assess the fetal heart rate pattern. That comes the first priority. Question number 35. Which assessment finding following on amniotomy should be conducted first? This question is repeated for the second time. Now we go to question number 36. The postpartum nurse is providing instructions to a client after delivery of a healthy newborn. Which time frame should the nurse should relay to the client regarding the return of bowel function? So in the postpartum client, which is the best time for assessing for the return of bowel function? Option A, 3 days postpartum. Option B is 7 days postpartum. Option C is on the day of delivery, and option D is within 2 weeks of postpartum. That will be too late. The right answer here, usually after delivery, the nurse can expect the bowel function returns to normal within 3 days of postpartum. Question number 37. Methergine is prescribed for a client with postpartum hemorrhage. Before administering the medication, the nurse contacts the physician who prescribed the medication. If which condition is documented in the client's medical history. So, a physician prescribed methergine for the postpartum hemorrhage client. Before giving this drug, the nurse will contact the physician regarding doubt about this medication. What condition if the physician was documented? Just you can see that option A, hypotension, B, hypothyroidism, and C is diabetes mellitus, and D is peripheral vascular disease. And this one is the methergine drug is not given for patients with cardiovascular problems like peripheral vascular diseases. Next question. The nurse analyzes the laboratory results of a child with hemophilia. The nurse understands that which result will most likely be abnormal in this child. The nurse analyzes the laboratory results of a child with hemophilia. The nurse understands that which result will most likely to be abnormal in the child. Option A, platelet count. Option B, hematocrit level. Option C, hemoglobin level. Option D is partial thromboplastin level. So in hemophilia, the partial thromboplastin time should be assessed for any abnormal findings. 39. A child is hospitalized because of persistent vomiting. The nurse should monitor the child closely for which problem? Option A, diarrhea. Option B, metabolic acidosis. Option C is metabolic alkalosis. Option D is hyperactive bowel syndrome, bowel sounds. So here the hospitalized child has persistent vomiting, and the nurse should monitor the child closely for metabolic alkalosis. In vomiting, all the upper gastric system contents will be going outside. As a result, it leads to alkalosis problem, metabolic alkalosis. Question number 40. After tonsillectomy, the nurse reviews the physician post-operative prescriptions. Which prescription should the nurse should question? Option A, monitor for bleeding. Option B, suction every 2 hours. Option C is give no milk or milk products. Option D, give cool liquids, clear fluids when awake and alert. So here, in the client who undergone tonsillectomy, the nurse reviews the physician post-operative prescription and she questions regarding which prescription. The right answer is the nurse should question regarding suction every 2 hours. Usually, a suctioning apparatus should be present in the client who undergone tonsillectomy, but suctioning is done if there is any obstruction only. If suction is done unnecessarily, it may cause irritation or it may cause injury to the surgical area. That's the end of today's video. We seen 20 questions today. In tomorrow's video, we will see another 20 to 40 questions. Thanks for watching Satu Career Online Nursing channel. If you have not subscribed yet, please subscribe now and write comment about this video in the comment box below. Take care. Bye bye.